One needle, one syringe, only one time. I'm going to say it again because a lot of you are still challenging me. One needle, one syringe, only one time. I said it in 3 different ways. I know you guys who don't practice medicine think that you can do certain things because it gets you by, or it's saving you money, or it's allowing you to stretch your medications, but it puts you at risk. Like, I see this every single day in emergency room medicine. I'm not trying to scare y'all. The truth is the truth. But anyway, let me just read this to you guys. From the CDC and Safety Injection Practices Coalition, they emphasize one needle, one syringe, only one time. Okay? Medications in single dose and single vials and single syringes lack the antimicrobial preservatives and therefore put you at a greater risk of becoming contaminated and serves as a source of infection when used inappropriately. And we're talking about things like hepatitis B, hepatitis C, staph, MRSA. Some of those things live naturally on our skin already, but when you are doing things that you're not supposed to do with these medications, y'all, especially if you have underlying health issues, it exacerbates them. It makes you put yourself at risk for bacterial infections, blood-borne infections. So this part, I don't want to lose y'all, but I just want y'all to listen at how they prepare these syringes in sterile fields, okay? It says, under the note USP 797, it states that a single-dose syringe or a single-dose vial open in less than iOS Class 5 air quality be used within 1 hour. Any remaining contents should be discarded. If a single dose syringe or vial is opened in iOS Class 5 air quality, it can be used for up to 6 hours. If it is in a sterile field, y'all, we got all kind of bacteria floating around, but hey, once you break sterility, that's it. Especially when we're breaking sterile fields at home. A study by the CDC and the Centers for Medicare and Medicaid Services published an article in the Journal of the American Medical Association found that 2/3 of inspected CMS-certified ambulatory surgical centers had lapses in basic infection control practices. Now, they're talking about medical facilities that have used open syringes more than one time, open vials that are single dose more than one time. This is the infection that they put the public at risk to. So they're speaking to medical professionals. So if they're speaking to medical professionals who have put the public at risk, what does that say about you putting yourself at risk at home? But anyway, it says in that study, some providers compromise safe infection control practices in attempts to prevent waste. The compulsion to prevent waste is sometimes exacerbated by medication shortages or costs. However, any cost savings achieved by preventing waste can quickly be offset by one or more adverse blood-borne or bacterial infections. Some patients died from these infections, and many others required prolonged, sometimes lifelong treatment and follow-up care as a result of using single-dose injectors and single-dose vials more than once out of that iOS level 5 air controlled situation. Now, I joke with y'all all the time, but when it comes to medicine, I'm never going to tell you something that is wrong. Now, like I said, we are all grown. You do what you feel like you have to do, but I'm telling you, in the emergency room, in clinical observation, cellulitis, staph infections, secondary to people using injectables, it's nasty. Those infections are nasty. And we have to use significant amount of antibiotics and infectious disease specialties to get those people back under control. Now, I said what I said. Y'all have a good day because I'm working in my garden today.